So, good morning. Our next poster is connecting the dots using targeted education to create a team of core lung transplant nurses. Please, if you want to start.
Okay. Hi, my name is Melissa Nugent. I'm the clinical educator at Texas Children's Hospital in Houston. So our poster really highlights a project that we took on because our hospital has a whole bunch of units all over the place that care for transplant patients, especially our lung transplant patients. They can be seen on probably 5 different units, if not more than that, including all of our outpatient areas and things like that. So one thing most people know about lung transplant patients is that they're not the least complicated patients, so it causes a lot of nerves and a lot of anxiety with some of our nurses, since it is seen less frequently than some of the other organ groups in our institution because the numbers are lower. But we decided to take that and make it better for our team on the 14th floor, which is our pulmonary adolescent endocrine unit. So they take care of all kinds of patients, cystic fibrosis, so they're used to that aspect of it. But they really wanted to be more comfortable in caring for the patients. And so what we did, the 4 lung transplant coordinators, myself, and then one of our physicians, one of our nurse practitioners, and one of our quality specialists all got together and developed a 4.5-hour class for these nurses. We offered it twice. We had a total of 17 volunteer attendees, and so they came on their own time because it was a special interest of theirs to learn more about lung transplant and be more comfortable. And so, like I said, it was a 4-hour class. Our goal was really to improve the care of our patients pre and post transplant for the nurses on the 14th floor, because they're the ones that had our patients the longest time most often. So we wanted to improve the knowledge and comfort of the nurses on the 14th floor and better integrate our frontline staff into our QAPI process and PI projects as well. So from this, we chose a core lung transplant nurse champion, and she comes to our monthly QAPI meetings and then reports that back to the other core lung transplant nurses. So it's been a really good way to weave everything together and have that communication to them and then back to us too, to make sure that we're really integrating them in our QAPI needs. So like I said, it was voluntary. We used a variety of teaching styles. We did case studies, quizzing, hands-on practice with chest tube care and things like that, and we got some really good feedback. You can see our agenda was here, so we split it into sections. We did, just a general background of our transplant program, our QAPI, what that means, what CMS is, and then we split it into pre-transplant, transplant, chest tube hands-on, post-transplant, and then also rejection and follow-up needs. And we had really good results. So on our knowledge assessment quiz, we did a pre-test and a post-test. So our pre-test score average was 79%, and post immediately following the class was 93%. So we showed a big uptake of knowledge there, and we were really proud of that. We also did a SurveyMonkey survey before the class to test their comfort level, and we got a 3, which on a 1 to 5 scale is not super great. Immediately after the course, we got a 4.3, and then we also did the same thing. So before course it was a 3, and then we followed up 3 months after the course to make sure that that comfort had kind of stayed there and remained the same. And course effectiveness 3 months after the class was still improved at 4.7. So we were really happy with the results. They rated the course a 4.9 out of 5 for course effectiveness, which we thought was fantastic. I think it was all the different teaching modalities that we used. And then 100% of them plan to make some type of changes in their nursing practice from the class and things that they learned there. So really we can say it was quite successful. We're very proud of the project. It's something we plan to hold annually for those that become interested when they hear their friends talk about it on the unit. And then with the success of this, we've approached leadership on other units to really talk to them about rolling it out there, so we can get a heart lung transplant champion and all those kind of things too. So we're super happy with it.
That's very good. Very good. Is there anything you want to share? Other thing you want to share with your colleagues on live telecast?
I would just say I've been really impressed with NATCO this year. I've been to a couple of NATCOs in the past, and I really liked the focus on communication and leadership this year. It's something that I've personally been working on anyway. I'm a work in progress, so it was really nice to hear, and the speakers have been engaging and funny, especially the communication ones. And then I've heard a lot of cool things about innovation and education and things like that normally you come and you hear about transplant and rejection and the same kind of stuff, but I really like how well-rounded it's been, and you have a little something for everyone. And so I've been really impressed with the conference this year. So you should come next time. That's my shameless plug for you.
So, what did you take away? One point about communication did you take away from this conference, and not the criticism? What is it called? The complaint sandwich.
Yes, not the criticism sandwich.
Right.
Do not use that. So, really, you should try to do 5 positive for any 1 negative type of thing you have to say. But really, it's treating people how you would want to be treated, and so you get to know the people that you work around or that maybe work under you, and you treat them with compassion and respect. I think that's how we all want to be treated. So really just taking that forward. And then also one thing I learned is, instead of spending time on Facebook looking when I have 15 minutes of the day, maybe spending that time thinking about what I can do better or how I could have handled something better, and really using that to go forward and be innovative and make change.
We had some donor hospital partners with us as well this year. Did you have any interaction with them, and if so, what were your experiences?
I did. Really, it was more on a social level. I really enjoyed talking to a lot of them and just kind of learning about what they do. Everything's so different. In Texas, we have a medical center, and so everything is right there. And Life Gift is our OPO, and so we have a good relationship with them. But it's been nice to hear about the different initiatives that people have to increase their donor pools, and really just networking with everyone. It's been great. But I've met a lot more OPO people this year than I have in the past.
Good. Thank you very much.
Sure.